People First Radio is a program about people, the society in which we live, and issues related to health and wellness.
Welcome to People First Radio. I'm Joe Pugh. Trevor Wideman is researching the overlap between the toxic drug crisis, the housing crisis, and local governments in small cities. That work has led the VIU postdoctoral fellow to link up with a Comox Valley group called Walk With Me. It's a community-engaged research project. One thing they do is record stories of people with experience of the toxic drug crisis or of homelessness, and then share those stories with community members in story walks. Christopher Hauchildt is operations coordinator with Walk With Me. On the first half of today's program, we'll hear from Wideman and Hauchildt about trying to improve outcomes for people caught between crises in smaller cities.
I am Trevor Wideman. I am a postdoctoral researcher, formerly a Michael Smith Health Research BC research trainee, situated at the Department of Tourism, Recreation, and Hospitality at VIU.
Hello, my name is Christopher Hauchildt. I am a peer researcher and the operations coordinator with an arts-based community engaged research project called Walk With Me. I am as well somebody who comes to this work with a lived experience of polysubstance use, of existing unhoused. And aside from all of that, I am a master's student at Railroads University in the Global Leadership Program. Happy to be here today.
And we have connected today to talk about Walk With Me and to talk about, Trevor, some of your work around bridging gaps for people experiencing homelessness and addiction at the same time in smaller cities like Nanaimo, Courtenay, the Comox Valley. Maybe to get things started, what do you think people need to know as far as context around when we talk about the toxic drug crisis? Where is that at in 2026? What are some of the most pressing things going on currently? We're
nearly a decade into BC's public health emergency around toxic drugs. They called it the overdose crisis, and some people still call it that, and some others call it toxic drug poisoning crisis. But April 14th is the inauspicious 10th anniversary of that public health emergency being declared. More than 18,000 people have died since 2016. And as your listeners probably know, the crisis continues to evolve. I mean, if I'm thinking about smaller cities in particular, we can see a sort of a different deaths from toxic drugs are often per capita equal to or greater than what we might see into larger urban centers. And I'll get into a little bit more of that. And even though we've seen the implementation of a lot of strong and evidence-based harm reduction interventions, at the provincial level and at the local level, like overdose prevention sites, safer supply, drug checking, decriminalization for a while, we know that the crisis is still happening, and some of these programs, like that I just mentioned, are have been rolled back or are actively sort of being challenged. So, in terms of my work and looking at smaller cities, I won't get too far into it yet, but municipal backlash to harm reduction has been an issue. I think over the last 5 to 10 years, a lot of local governments have responded with, bylaws or rhetoric rather than supporting evidence-based approaches, often due to perhaps lack of expertise, pressure from citizens or business communities, or just because it's easier, especially when healthcare is a provincial concern. And so there's this sort of push and pull, a tug and war between different jurisdictional contexts. And so I think that's sort of where I see it at the moment, and on a very general level.
Well, it's perhaps almost unfair in a sense to ask you to just give me context in a couple of minutes about the toxic drug crisis and addiction and homelessness. People often point out that each one of those things on their own is sort of a distinct issue, and they can tend to be just kind of all lumped into one unsolvable problem in some framings, when people have suggested, well, they're not exactly the same thing. Sometimes they overlap, and that causes problems. What do you think? What is your take on that idea of there is homelessness, there is people dying from toxic drug poisoning, there are people experiencing addiction. In some cases, those three things all rolled into one. In some cases, only one of those things. What do you think people need to know about that idea?
I think they're often conflated. All those ideas kind of get lumped together in the public mind, in the public discourse often. An idea such as homelessness automatically gets, lumped in with perhaps substance use, or it's as far as I can tell, sometimes the media does a pretty bad job of sort of unpacking or teasing out the differences between those two things. But of course they intersect. And of course they, somebody who might be homeless might turn to substances to just stay warm at night. Like we don't know all the reasons why things intersect, and it's individual often and place specific and context specific. But I guess my thought is that we can't really talk about one without the other, but often the way that they're framed in the media is just that, like, there's an assumption that somebody that might be homeless uses drugs, or the reverse of that, the only people that use substances are people that are homeless. You know what I mean? Like, so they get kind of mashed up into the same bucket. But whereas certainly the toxic drug crisis is something that is much broader. We know that most drug poisonings in BC actually happen in private residences and not on the street. That's from the coroner's report. So it's not it's sort of a known fact, and it's not, and it sort of pushes back at the idea that, like, it's only people that are on the street that are using, say, illicit substances.
And perhaps trying to get away from this idea of conflation, or trying to untangle some of these threads, is a perfect time to talk to Christopher about Walk With Me. So you've got this project. It's focused on community engaged research. You're also taking people on story walks where people can hear individual people's stories on some headphones while they walk through the places that those people live. Can you tell me a little bit about that project and maybe how it relates to what Trevor was just talking about there?
Yeah, absolutely. A bit of context around Walk With Me. This is a project that began back in 2019 out of the Comox Valley Art Gallery. And really it came about as a response to just bearing witness to an overwhelming loss of life being experienced in and around the gallery, youth and programs, artists in which the gallery was working with, and folks living just outside were losing their lives at an unprecedented rate in 2019. And after so many celebrations of life, this question of what can an art gallery do to make change came about. And through institutional partnership, we were able to conduct this work with a research capacity. And through partnerships with service providers, we were honored to sit in circle and be gifted powerful stories around people's experiences of this crisis, firsthand accountings of people with living experience, with lived experience, people who had lost loved ones, medical health officers and service providers. And we were honored to be able to weave these stories together into these audio tracks. And then COVID hit, and we couldn't really continue to meet indoors in spaces in circle to continue the dialogue in which we'd started. And so out of necessity, we began walking with these stories with a set of silent disco headsets. What was born out of necessity became a core practice of what we do. It is what our project is called, this act of walking. There's something somatically about walking with what can be difficult stories, but not alone, and having that privacy to reflect. And it seems incredibly important, as Trevor has highlighted, amidst this crisis, it's often conflated, essentialized, universalized in policy and decision-making, and there isn't always the opportunity to hear from individuals what their stories are, what their circumstances and experiences are. And so I think that there is a danger in assuming about other people's experiences. So really attempting through this project to invite in that firsthand lived experience into conversations surrounding the crisis. And as well, just to complement what Trevor led with, and things to know about this crisis, I think it's important that listeners know that the toxic drug crisis is the leading cause of preventable death on Vancouver Island and has been for quite some time, that this is a crisis that accounts for more death than car crashes, suicides, and homicides combined. Predominantly men aged 19 to 59. And as Trevor mentioned, predominantly individuals passing at home alone in private residences, which I think really shifts the perspective of who is affected amidst this crisis from one we often see in the media, somebody who might be unhoused, to that of working professionals as well within their residences. And I think it's important to acknowledge that reality of this crisis when talking about it.
Could you give me some idea of what are the details that people are sharing in the clips that become these story walks, and how does that information filter through to the people who are going on the story walks and wearing the headphones?
This is a really great question. So Walk With Me has been really privileged to work through invitation in many different communities, in many different institutions. And we've heard as such a wide array of people's lived experiences, their stories, and always wanting to avoid universalizing or essentializing the breadth of experiences we're hearing. But some of the sort of recurring themes we hear about often are adverse childhood experiences, trauma, be it domestic or the trauma of residential schools and colonialism, violence. We've heard time and time again of stories of people incurring injuries and becoming dependent on pharmaceuticals and having those pharmaceuticals taken away. So central to this crisis, often it seems to be trauma is highlighted.
And Trevor, if I understand correctly, a big part of your work is working with municipalities of the size of a Courtenay or a Comox or a Nanaimo to help bridge gaps related to maybe some of what Christopher was just talking about there. Could you give me a sense of what specifically are those gaps? What do they look like, and what could be done to address them?
Yeah, that's a really good question. I think maybe I would also, just to sort of speak to what Christopher was saying too, we've been working together for probably over 3 years now, a lot, and I've been working alongside Christopher in this project Walk With Me. And I think what we've learned through that time, I think a lot of sort of specific things to smaller cities where, I think smaller cities, they often don't have the exact same health, social, or economic infrastructure as places like Vancouver, Victoria. A lot of local small city governments often face these sort of intense public pressures and limited capacity to deal with crises that may have more recently arrived at their doorstep, which can often lead to more reactionary local policies that in some cases, not every case, but can conflict with health evidence or maybe even come into conflict with policies coming from the province. And I think some of those policy gaps that we've been seeing are that the experiences of people with lived experience and often Indigenous community members can be ignored or sidelined within contexts around how these crises play out at the local scale. We've worked extensively within the health authority and seeing how there's harm reduction that's sort of rooted in population health science, and then in some cases also qualitative studies that might contain knowledge from people with lived experiences. But municipalities can often rely on more legal responses, like bylaws and regulations that are enforced by maybe police or security or bylaw officers, and those kind of actions can push people further to the margins. So there could be maybe say a bylaw that's restricting public space use or targeting visitable poverty, which might come into conflict with, healthcare goals around safety and access to care and stability of the patient or the person who's seeking care. And then also there can sometimes be a lack of understanding. I'm not going to let the province off the hook either. There's a lack of understanding at the higher level of government sometimes about the unique needs and political dynamics of smaller communities, when these sort of larger policies come down. So there's a lot of sort of complications, and there are gaps between those. Say, like as you can sort of see, like the mandate of healthcare is different than the mandate of a local government, and it was not so long ago, I believe 2024, that the Auditor General of BC noted that municipal resistance is a persistent, quote, persistent known barrier to the implementation of harm reduction programs at the local level in BC. And so it's in thinking about those, it's sort of where this sort of project came from. A lot of the work that Walk With Me has done in the past has been and still is doing is between the health authority or different community group service providers, and this is really an expansion of that work into the municipal government realm.
You're listening to People First Radio. My guests are Trevor Wideman and Christopher Hauchildt. Wideman is a postdoctoral research fellow at Vancouver Island University. His work explores health policy and municipal governance in smaller BC cities and its intersection with lived experiences of the toxic drug and housing crises. Hauchildt is based in the Comox Valley. He's the operations coordinator of a project called Walk With Me. It's focused on community-engaged research around the toxic drug crisis. One initiative Walk With Me runs are story walks. People wear headphones and go on a tour. During that tour, they hear stories of the drug poisoning crisis gifted to the project from people with lived experience, family members, and frontline workers. Is there one particular example that you think is particularly illustrative of this? You were talking about perhaps municipalities, say, has bylaws restricting people's use of public space, or the response tends to be like a legal enforcement one, whereas there might be an opportunity or like a need for it to be a health-focused one. Is there one kind of example of a barrier you can point to, or a situation that's happened that your work is trying to address?
Mm-hmm. Well, so I'm not going to point the fingers at any particular municipality at the moment, but because really this is the project's at the beginning stages, but there is evidence over the past 10 years, certainly or more in BC of communities that have, we can think of examples like dismantling homeless camps. We can think of things like street sweeps in not just in the downtown east side, but even in smaller municipalities in the Fraser Valley. And if we think about Vancouver Island, there's a conference every year called the Union of British Columbia Municipalities, where municipal officials go and advocate for their causes to the province. And we've seen resolutions coming up at that conference that are directly about these types of enforcement actions, and they come from municipalities all over the province. So there's a gap between these different conversations. Yeah.
How do you go about bridging that gap? What does that part of it look like?
Mm-hmm. Yeah, so the goal is to bring health providers, municipal staff, and people with lived experience together to find common goals. And so with Walk With Me, you've heard about the story walks already, and those are often combined with sort of research-focused community dialogues to offer a more structured, and they sit in circle and people share their reflections, not only on what they heard, the stories that they heard, but they often are asked a specific question around, how can we do better? What are the gaps? Where do they need to be bridged? And so those research-focused community dialogues, they offer the sort of more structured and culturally safe way for people to hear firsthand experiences of not just people with living experiences, but just to reflect and begin to co-create solutions together. And so the aim being to reorient these sort of small city harm reduction conversations and responses toward more place-based, compassionate, and collaborative responses, not just these more, bylaw-based or, some more punitive approaches.
Christopher, when you're working with Walk With Me to do community engaged research and then you're sharing that research with people, how do you make sure that it lands, or how does it translate into something?
Great question. And I think it's often the case that through the process of story walks, we're attempting to root a conversation, a dialogue, systems change, not just in opinion, not just in assumption, but in lived realities being experienced. And it's, been my experience that over hundreds of these story walks now and sitting with people, that it is almost always the case that after having a moment to sit with somebody's story and hear that lived experience, that circumstance, that very humanized reality, that there is an emotional connection, human to human, that is fostered within that room. And this feels like an essential and often missing component in policy development and systems change, to connect first as human beings, to see other people. I think it's really easy within systems of policy change to get caught up in assumptions and biases and the universalization of people's experiences, especially given how politicized, how moralized this public health emergency is, and the dominant rhetoric we see through media. And so removed policy decisions, systems change, removed from that human to human element, that firsthand experience, I think often there's a big gap in systems and policy decision affecting in a relevant way the on the ground experience. And so as a methodology to try and bridge that, certainly, if we're delivering findings surrounding research we've conducted, we try to invite that space of a story walk experience first. It's worth mentioning as well that we're a multidisciplinary team, that there are a myriad of different types of people on our project team. We have artists, researchers, people with lived experience, cultural leaders. And it's important, I think, to have such a diversity in perspectives holding and informing this work, because there are many people affected by this crisis and many perspectives and lived realities not accounted for often in those rooms.
How do you get people to maybe buy in, or maybe a kind of another side of the coin of that question is, are there ever times where perhaps people in decision-making spaces are kind of engaging in this research and it seems to be landing with them, but then there are also other factors that are kind of influencing them and it kind of stalls somewhere along the way?
I would say absolutely that is the case. As Trevor mentioned, and as was acknowledged at the beginning of our interview, the toxic drug poisoning crisis is a wicked problem. It is the culmination of many complex problems intersecting with one another, many of which, that have been evolving over centuries, not just the last 4 or 5 years, not just the duration of the toxic drug crisis, but important to recognize the longstanding history of complexity in politics surrounding the crisis and histories of criminalization, of colonization. And so to say that there are many factors applying pressure and weight in decision-making amidst this crisis, I would say it's absolutely the case that oftentimes people in positions of decision-making and policy development and leadership might, as human beings or themselves, wish to make decisions, but because of institutional will or political will, it isn't always the case that they're able to make the decisions they might like to amidst this crisis. There is a history of geopolitics affecting this crisis as well in decision-making amidst it. Trevor, I'm not sure if there was anything you might want to add in the response to that question.
Yeah, I mean, only just that, like you, as you mentioned, you might get a positive response, or you might get some action on an issue that needs to, be acted upon in a community, and sometimes due to those pressures, minds change, or the political will is not there anymore, and we saw that, quite recently. I mean, there was the political will around decriminalization, which was quite strong at the beginning of that pilot program, like completely collapsed and is gone. And so, I mean, and that's that is true that it is at the provincial level, but there was those kinds of things that a project like this might advocate for at times, and like different say community interventions you just never know. Like, you can only hope for the best, and get people on board, and as many people on behind you as possible. And I think that if the research findings are true to, what people said, it's hard to ignore, like, and you have like a robust sort of group of people informing the work that are standing behind it. It's hard to kind of argue with at a certain point. But yeah, it's true that of course things can shift and change.
So maybe given that, if we were to bring the ship home and say a couple of years have passed, your work is farther along, is not just in the starting stages, what do you hope you are able to accomplish? What kind of change do you hope this makes in I'll say the world, or maybe central Vancouver Island?
Well, in terms of my work, I really hope that it has some influence on municipal responses to this crisis. And where we're at right now is we're seeing, certain voices within the community being prioritized, and often that leads to political pressure and shapes public discourse. And what I would hope for is that, like, that there can be less of a pushback against like strong evidence-based harm reduction interventions and housing programs, and that people that are most affected have their voices heard in a really meaningful way. That would be my desire.
Yeah, perhaps my dream amidst this work is a bit loftier, in that I would like to see the day where there is no work in this field, in that there are no people dying from preventable deaths amidst toxic drug poisonings. Again, highlighting that these are preventable deaths. For me, when I think back to the history of our work over these last 6 years, recognizing that our body of research spans a myriad of reports across communities and institutions, and a recurring finding within all of our research is the need for leadership of people with lived and living experience amidst this crisis. And I see, drawing on my own lived experiences of this crisis, and from what I've heard from many other people, that amidst this crisis, there is often a hopelessness, a meaninglessness, a purposelessness endemic to the compounded trauma of losing lots of friends time and time again over a decade plus. And I see also so often within the communities of people with lived and living experience, just an incredible capacity to give, to nurture, to address this crisis. And I also look at that willingness juxtaposed to our institutions, which are not necessarily the best equipped to delegate and navigate with other people with lived and living experience. There's a need for those perspectives, those lived experiences within institutions, I believe, to bridge connections and communities, recognizing the volume of stigma. It's a lot easier to see somebody and to understand them when you've walked a similar path. So my curiosity, my exploration, my hope is to create possibilities and positions and opportunities for other people within this crisis to rise up as leaders, to lend their lived experience, their voices for change, as a means to sort of honor the gravity of loss of life, and as a way to give back in service to that community. I see it as a latent potential that's been untapped.
Is there anything else you think it's important to bring to this conversation today?
Yeah, for myself, I think what often keeps me up at night amidst this crisis is thinking about the future of children, recognizing, as we've heard time and time again, the effect of trauma, of intergenerational trauma, as one of the social determinants of health that seem to feed into and catalyze this crisis in such a profound way. And how time and time again I hear of young people, in their 30s who are parents who are passing away. And I think of the compounding harm of children, a generation of children growing up with the loss of their parents, their uncles, and I think of those compounding effects, and I think of our future generations and the challenges that experience in this crisis. That's what I think about quite a bit, and I think it's important to consider the effect of trauma and intergenerational trauma amidst this crisis on our future generations.
Christopher, Trevor, thank you very much for taking the time to speak with me.
Thank you, Joe.
Yeah, thank you very much.
Trevor Wideman is a postdoctoral research fellow at Vancouver Island University. Christopher Hauchildt is operations coordinator of Walk With Me, a community-engaged research project in the Comox Valley. We were speaking about Wideman's research focus of the intersections between the toxic drug crisis, the housing crisis, and municipal government in small cities.
People First Radio, People First Media, and People First Stories are community media projects of Vancouver Island Mental Health Society and are produced in Nanaimo, British Columbia. The opinions expressed do not necessarily represent the views of Vancouver Island Mental Health Society or its broadcast, podcast, and social media partners.